what exactly epilepsy is and how is it different from, say, a one-off seizure?
Epilepsy primarily is a brain condition. It's not any other part like spine or abdomen involved. It's a brain condition wherein there is an abnormal electric activity in the brain resulting into unconsciousness and movements of the hands and limbs, or either motor or sensory symptoms. Means you may get some tingling numbness, you may get tonic-clonic movements, or the body could become stiff. Either it could be loss of consciousness or without loss of consciousness. So that is called as epilepsy. Now, this epilepsy and seizure difference is if there is just one activity, motor activity, then it is called as seizure. And a person suffering from epilepsy is a multiple episodes, two or more seizures with beyond a 24-hour difference. It should not be within 24 hours. That is termed as epilepsy. Child has just one seizure and nothing after that, not epilepsy, but has once a week or once a month seizure.
If there's a recurring pattern.
Recurring pattern.